conservative type preparations and have bonded veneer restorations. So the full coverage is going to allow us to increase that material thickness to a point where we have greater masking ability, and we can fairly much guarantee that patient that we won't have show through that discoloration. So here are the preparations for the full coverage and the veneers on the laterals. We have anterior guidance, and that's the amount of separation that the anterior teeth provide, and that we can play around with to a point. Then there's plane of occlusion. We know that a flatter plane is easier to disclude. A curved plane is more difficult. And then there's the actual axial inclination of each tooth. We know that teeth that are straight up and down are easier to work with. We know that a tooth that's leaning over, the back end of the tooth is sticking up, and that creates a problem in posterior disclusion. And lastly, each tooth has a cusp fossa inclination, probably much more understood by the technician than the dentist, sort of needs their own. So let's look at the puzzle in a skull. We see a set of teeth. We see, okay, what's the template for treatment planning? Well, first of all, I would say we've got to establish periodontal health. Second, I would say, let's always establish joint and muscle health. So that's the foundation.
Some things that I think are very important, some things of life, we then have to have the appropriate biology. So it's important to understand that it's these three things that have to work together for us to be successful. Let's look at the history of what has happened in dentistry over the past few decades. Back in the 60s, occlusion was the big thing. Nathology was taken off, and we started to understand concepts of occlusion better. In the 70s, perio became the big deal. In the 80s, it was on to composites and to adhesion. In the 90s, everything has been tooth-colored stuff, and there's so many systems that are available. And today, so much of what we do is we fix the stuff we did in the 90s. I contend that those failures have less to do with the materials and more to do with how we utilize those materials than anything. You're probably aware of one of the studies that looks at all porcelain restorations on back teeth. And isn't it interesting that the survival rate of those after 5 years is only 79%. Again, I contend it's not necessarily the material, but it has just as much to do with how we utilize that material that matters. I have a very close relationship with my lab technician. I would tell you that I speak with him almost every day. I don't know how I can have an effective restorative practice if I don't have that kind of communication with my technician. And no different than many practices, the question comes then, when it fails,